Hi everyone, I'm Dr. Alan Miner from HealthQuest Chiropractic. I want to talk a little bit about today what we do when people have been in auto accidents. Most people don't realize when two cars collide, even at 5 miles an hour, your neck will do a double whiplash within about a half of a second. And what that can do is it can change the shape of the spine. You're supposed to have these arcs, a 60-degree, we call it a lordotic curve in your neck and in your lower back, and then an opposite 60-degree curve through your mid-back or thoracic spine. And so when metal hits, when cars collide, our bodies are far better shock absorbers than your automobile. And what that can end up doing is shifting that spine out of alignment, and then you end up with soft tissue injury, and it can even end up interfering with the nerve signal the brain is sending to the body and the body back to the brain. And what we call that, you're probably familiar with the term whiplash. When somebody's neck is whipped back and forth, it can throw the spine out of alignment and the vertebrae begin not moving properly. And so that lack of motion in the spine when it's out of alignment can compound into all kinds of different problems. So what I want to show you is how we adjust a whiplash in the cervical spine to get range of motion back in there. It's a question a lot of people have is, well, what does an adjustment look like? So what we're going to do here is we're going to focus on two of the levels in the cervicals that have been fixated. And what we've run already is a scan, an electromyography scan that actually measures where the muscles are contracting. And as you'd imagine, your muscles should be pretty symmetrical on both sides. So we're going to set this vertebra on silver right at C4, C5, and up top at C1, C2. And it's that little movement, but what it does is it stimulates. If we had her in an MRI machine right now, her brain lights up like a Christmas tree because of all the input from the proprioceptors firing off to the brain, which helps the brain then change how it's controlling muscle symmetry, so that as the muscles become more symmetrical, range of motion comes back in the spine, and that's how we help people recover from whiplash. So hopefully you're not in an accident anytime soon, but if you are, please consider giving us a call.